The head of the Veterans Administration is talking about the new act that'll give veterans access to private health care.
Legal editor Julie Grant met with him when she was in Washington to interview members of President Trump's cabinet. They talked about that and some other issues as well that are important to veterans.
It seemed like if they're waiting online for 9 days and they can't see a doctor, why aren't they going outside to see a doctor and take care of themselves, and we pay the bill?
Giving our nation's heroes more healthcare choices and benefit opportunities is the goal.
And over the last 500 days, we've done everything that we have been able to do internally to create the right environment for veterans, to be able to choose VA as a great option, to be able to choose a local provider if that's a better option for them.
A veteran himself, acting VA Secretary Peter O'Rourke admits since the healthcare scandal surfaced in 2012, the department has been under the microscope.
Can you say to the American public that veterans are getting the standard of care in VA hospitals that they deserve?
Let's talk about the facts. We have 168 hospitals across the U.S., over 3,000 community-based health clinics. We have over 300,000 employees that come to work every day with one goal in mind: to take care of veterans.
Advances were made last year when President Trump signed into law the Veterans Accountability and Whistleblower Protection Act.
After everything that's occurred, can you say that they are getting the proper standard of care?
I believe they can. This president has made a promise to veterans. We know that there's been things that we can improve on. We've worked hard on that. I was just in Manchester, New Hampshire yesterday to watch a leadership team that's come together that's meeting the physical needs, meeting the emotional needs of veterans every day.
I asked Secretary O'Rourke about a KDKA investigation that revealed inadequate coverage for veterans who got sick from exposure to burn pits.
There's been issues with that being recognized as something that should be covered medically and taken care of.
In the big picture, we have lots of these issues that come up that we want to recognize with veterans. We research and we're looking into all those. We have multiple different challenges that we've faced through different conflicts that we've been in, especially our newer veterans that are coming out of Iraq and Afghanistan.
Another major focus for the VA going forward is caring for the families of veterans as well. Acting Secretary O'Rourke told me that much of the early work on the Accountability Act was done with a team here in Pittsburgh. He also told me to deliver a message to our heroes here in Western Pennsylvania, and that is, please don't hesitate to reach out. Live in the studio, I'm Julie Grant, KDKA-TV News.